Hey Staten Island, this is HealthWish, a conversation about the state of healthcare in the fabulous 5th borough. Our aim is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. Today, we are center stage at CSI's Center for the Arts for episode 2 of 3 with Northwell's Director of Global Health, Dr. Eric Coie-Peña. Dr. Coie-Peña is an emergency medicine physician and leads Northwell's mission to raise health on the international stage. As promised, we kick off today's episode with a retelling of some lighter moments from the team's recent adventures in Guyana, including menu misadventures, tarantulas, tiny bush planes, and high-speed boating on the rivers at night. The episode concludes with a nod to the Global Health team's roster of specialists, who combine some very long hours and challenging work with a genuine spirit of camaraderie and adventure. Is there a difference between a mission and a medical mission? Give a listen and find out.
So switching gears a little bit, with all the work that went in, what are some of the real fun sides of global health? I mean, my trip, we did a lot of work, long days, running around, but there's always a little misadventures and fun about it. Tell me, what is it that really fires you up about global health?
Yeah, I mean, for me, I do become kind of, my team jokes that I'm almost like hypomanic when I'm there because I'm sleeping like 4 hours a night. My brain is racing. I'm working 20-hour days. So it definitely is a lot of work, and I'm exhausted when I come back. Like a 2-week trip for me, I think I aged like 6 months. But that being said, one of the things that I think is just amazing is just the people that you get to meet. You get exposed to like just little snippets of culture. There's an expression in Guyana that if you eat lava and drink the creek water, you'll never leave Guyana, or Guyana will become a home to you. And so we had a little experience like that. You remember when we were in Mabaruma, we were staying at a hotel overnight, waiting for our flight out in the morning.
The guest house.
Yeah, the guest house. Yeah. We had just completed this, needs assessment of 2 different hospitals for the WHO emergency needs assessment. And Dr. Jeffrey, very funny, he says, you have to try the lava. And we were trying to get in a sense from what is lava? And he's like, it's kind of like a rabbit. And like I looked it up on my phone, and it looks like a capybara a little bit, but it's like if a capybara mated with like a guinea pig or squirrel or something. So it's
which he
smaller.
Didn't eat, by the way.
Yeah, so that was the best part. He's like, we're at dinner, and he's like, you got to try the laba. So there's 4 of us there from Northwell and Dr. Jeffrey, and so we're like laba, and we get to Jeffrey, and he's like, I'll have the chicken. Yeah. Just like, we all cracked up, like, we've got to try it.
And it wasn't like we're at a restaurant. We're at a guest house, but as a woman who cooks this family style meal, so you're not going to be like, I'm going to change that. You go with it.
So he's like, you got to try it. I don't really like it, but you've got to try it. Yeah. So it's just funny moments like that. You get to really know people, and I think even Dr. Jeffrey's comments, he was very wary of us, and he said this publicly, I think, so I don't think I'm...
He said it on camera with me.
Yeah, he said it. So, he's very wary of our relationship at the start of the week. He was like, you guys have come before, you came in 2019, you promised the world, and you didn't deliver in 2019. And he's right. We had this little virus that exploded in 2020 when we were getting into our implementation phase. Yeah. But that was the memory he had of us. And so by getting to know us for over that week a little bit better, he's like, I totally changed my opinion of like, I could see into your minds and your hearts, and I could tell that we were in the right place. Yeah. And I think those experiences really do kind of summarize what the value of global health is to a system.
Yeah, I think that the relationships that we formed on the personal level really sets us apart from other people and other organizations that do come down. He did self-admittingly say that he is sometimes not the easiest person, or he is perceived as a person that's very reserved, but he let his guard down. And I don't know if that's because of an encounter with a tarantula that's what does that. I don't know if that was before or after that interview, but we had that whole experience that I think there was a really good bonding moment aside from the boat.
Yeah, the tarantula was interesting. So we're all having like an afternoon freshman's, and we see this thing crawling down one of the chairs that was.
So you weren't sitting on it?
No, I wasn't.
Oh, because I saw the picture.
No, I wasn't sitting on it. No. So if I'd sit on it, I would have had a heart attack right there.
You had a heart attack later on.
It's ironic that I'm the director of global health because I don't like small planes, which is neither here nor there. But I go in a lot of small planes. I don't like them, and I'm arachnophobic, so I don't like spiders. And I've been to a lot of places with lots of big spiders. And this is one of the biggest ones that I've seen. It was a tarantula just like 5 feet from us crawling down the chair. And, I like to think, though, at least that I didn't have the worst reaction of the Northwell group. No. There was a couple other people, and we won't mention their names, but they were senior vice presidents screaming, kill it now, over and over again.
So I was kind of on the property trying to get some footage of the town. And I was really being mindful of snakes because, everybody's like, you got to watch out this, that. I'm like, snakes, spiders, mosquitoes. Those are my 3. So I'm really watching out for snakes. And as I come back, one of the team members came screaming, Christian, stop. And my heart was already racing from, being careful. And then it was like, there's a tarantula. And I was, where is it? She's like, it's over here. I'm like, I'm nowhere near there.
Yeah, there was a little bit of hypervigilance, I think, after that. I did a very thorough search, just so you know, of my hotel room after that. The hotel room was excellent. I had a great night's sleep, but I made sure that the hotel room was tarantula-free before I went to sleep.
You were on edge, because there was at one point when I was just looking over my shoulder and I saw a van come, and maybe it was my reaction to it, because I wasn't...
You jumped like this, and I was like, what is it? What?
Yeah, that was good. But I think, those kind of experiences, for Dr. Jeffrey, maybe that was what we needed to break work with Dr. Jeffrey. And, just even traveling to Barbaroumba was insane too, the boat. And, the way you described the small plane, and it's news to me because you sounded very gung-ho about the plane.
Yeah.
It's like, 4-person grass field. And then I'm hearing
I do it a lot.
Yeah. Well, I'm also hearing from our liaison, Aaliyah, that she was like, the plane and Region 1. So I was a little anxious. Only to see that we've landed on, an asphalt runway, so that took that one off. And then we're driving, and then you're saying, we're taking a speedboat. I was like, well, let's just redefine that and just say boat, just in case. But it was a speedboat.
It was a speedboat,
Yeah, that was the fastest ride I've ever taken in my life, which was an hour and a half down the Coie-Peña River.
Yeah, that captain, I think we both looked at the captain and saw that he was like in his late 60s.
He was salty.
And we were like, all right, you've done this a couple of times before. 35 miles an hour on the water is nothing to laugh at. That's
no
fast.
brakes.
Yeah, there's no brakes, and he's cutting around tree stumps and shallow portions of the river, and you could just tell that he has done this a million times and knows the river like the back of his hand. And what was even more impressive was that Dr. Jeffrey told me that they also do that route at night. So like in the middle of the night, they're doing river navigation. So I can't even understand how you would do that safely.
Yeah, I think that's not the young man sport. You want that seasoned, but I guess that's what you want in your pilots as well, too, the experience. But it also really does speak to the distance. We were on that river for an hour and a half at that speed. So that's a great distance.
Yeah, it was definitely challenging navigation even within the region, between cities. When you think about if that's how you're going to get a pregnant woman to the obstetrician, it's a rough boat ride if you're in active labor.
Another thing to bring up also about that bridge we were discussing is just like Staten Island, when not a natural disaster, but even just some sort of emergencies going on. A lot of our bridges closed, so we're on an island. We're a little isolated, obviously. We have a good experience in that, so that really could translate well to them.
I think if we had the resources that Staten Island University Hospital had, I'd be much less worried about the bridge closing. As somebody who's worked various snowstorms, we affectionately called it Snowvid, which was, I think, the blizzard in the middle of the second COVID surge, at a field hospital. I feel much more self-sufficient than I do, I think, when I work globally. But certainly it is a concern. And, having a bridge closed is part of the emergency plan of our hospital, and it's an important one. You're not going to be able to, especially during a snowstorm or a hurricane. The other options, the bridge really is the safest way to go across, right? So if the bridge is closed, like, you're not taking a boat, you're not taking a helicopter, so you need to be self-sufficient. Absolutely.
What can we learn from them? This is not really a one-way street.
Yeah. No, they have an amazing primary care delivery network. And I remember when the Region 9 team came back, they were saying that there are some villages, the community health worker knows every pregnant woman in the village, knows when she doesn't show up for her appointment and goes and finds her. And so that's pretty impressive. The level of kind of community outreach and level of knowledge that they have in the primary care is admirable. And I think that we can take aspects of that and adapt it to our environment.
Especially with the human resources they have. There's still only a handful of providers.
Yeah, they're using, when I say community health workers, these are lay people that have been trained for, hours, not years on some topics to prevent, identify and treat childhood illness, identify and treat women's health, identify mental health crises and refer them. But they're kind of the eyes and ears of a rural public health network that allows for very few doctors to cover a very large area of patients, because you've got these community health workers that are going to be able to identify issues early on and refer them. And either, region 1, they were talking about the doctors will even go to the patients. Because of the treaties they have with the Amerindians, they have to go get them and bring them out. That's a tremendous network.
The clinicians that went down on trip 1 and trip 2, could you just talk to me a little bit about the teams, the disciplines?
Yeah.
This was not just some, 1 or 2 people. We had some heavy hitters. We had some people really diving deep.
Yeah, our team was senior leadership in psychiatry, OBGYN, family medicine, pediatrics, emergency medicine, pathology, general surgery, anesthesia, research and research methodology, public health. So we had some heavy hitters. We brought a very robust team down. That's one of the reasons that we are very proud of how we do global health. So when we go down to do a needs assessment, this isn't like me and one other person saying, how can we help? We're asking in advance who's going to be useful, and then we bring a team down to meet that need so that we can get a really good idea of what the next year is going to look like.
You had clinical chairs. You had people that really do it from the top down that know all that nuance.
Yeah, so the vice chair of education for psychiatry, the system chair for family medicine, these are all thought leaders. I think it also shows just how committed the health system is to global health. The vice chair of psychiatry, who couldn't come on the second trip, texted me and said, I'm not going to be able to make it. My schedule's not going to work, but I just want you to know this is some of the most rewarding work that I do. I think that is really important, that we see just the level of engagement, especially of senior leadership in this. And this is mission central to the health system.
Let's briefly talk about that, the word mission. There's some key terms that we use that kind of just used to invoke an action of what we're doing, but there are certain words, and I'm guilty of it myself, using the term mission.
Yeah.
How do we have to be careful about things that when we're using terms?
Yeah, so usually when I reference mission, I'm talking about the mission of the health system, which is very different than the term medical mission. And the term medical mission in my world is kind of a dirty word, because medical missions are usually described as, you fly somewhere, you set up a health fair or a tent for a week in some rural area, you don't tell the government you're coming, you treat some patients for diabetes and high blood pressure. You give them free samples of 30 days of medication.
Feel good about yourself.
Take a lot of pictures, and then you leave. And so it's very much one-sided. It's very much about the experience of the US-based practitioner going and giving back. And that, there is value to that. I don't want to poo-poo the value in somebody who's,
heart's in the right place.
Yeah, their heart's in the right place. They're slogging it out here in New York, and they feel different about providing healthcare in another country, and that's a good feeling. We want to keep that good feeling, but change the trip so that it's a sustainable trip. You don't want to diminish the feeling that people have when they're visiting kind of other countries and delivering healthcare. That we want to harness that, but we want to change kind of the other side of this, what the host sees, so that this is part of, instead of a medical mission, it's a global health trip that's part of a 5-year agreement with 1 year that's really pretty granular about this is what you can expect from us over the next year in terms of what we're going to do in terms of service delivery and education.
Next time, Dr. Coie-Peña offers his expanded definition of mission versus medical mission, describes how Northwell's approach to mission protects local economies, touches upon Ukraine, and challenges other health systems across America to rise up and raise health. HealthWish wishes to thank our very special guest, Dr. Eric Coie-Peña, Director of Global Health for the Northwell Health System. We're interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.